Hello, thespians, and welcome to the Beau-Tea. I'm Elizabeth Deo.
And I'm Jess Adams, and today we're going to be talking about Botox for actors.
What?
I'm terrified. I've never had any sort of injectable, and I've always been like, I'm never going to do that. One, because I'm an actress, and you obviously, mobility in your face is very important.
Mm-hmm.
But two, I think that there's a stigma.
People think Botox is like frozen face, can't move.
That's what I thought, yeah.
I mean, a lot of people just don't want that, especially actors. We have to be able to emote. But we don't want to be wrinkled and like look older than we are either, and especially with like HD and everything like that.
Right. My ideal would be when I move my face moves.
Yeah.
But when I'm not moving my face, I've come to realize that I have deep set lines in my forehead when I'm not moving my face. And for me, like, that is what I don't want. So that was kind of the thing that clicked in my head of like, wait, when I'm still, I don't want these really deep set lines, but I want to be able to, you know, be expressive.
Still emote. But hopefully, like, we're just like a little, like, don't have this when we're chilling.
I know nothing about this, and I'm terrified. I think it's scary because, and I have to remember though, like, some people want a done up look.
And that's cool, man.
That's totally fine.
Do you?
Yeah.
But this specific episode, we are doing Botox for actors, so we can show you that stuff doesn't have to be overdone. You can do things very specific, minimally placed, just to like soften, make you look a little bit fresher, but without freezing everything up.
Yeah, like you want people to be able to look at you and not be like, she got some shit done, which is like, that's the goal. In acting, you never really play your age. You want to be looking your best, but it is a scary step to take. I'm terrified. So
we're going to do it.
We'll get the beauty for you.
We are here today with Dr. Rahi. She's going to talk with us about Botox and specifically for actors. What do people have wrong about Botox? What do they have in their mind that's completely false?
A lot of people think that they're gonna look super fake, super plastic when they inject Botox. That really is not the case. I think the technology has improved so much and injectors have become so much more experienced, understanding, you know, the muscles of the face better. Now, injecting Botox, we use smaller amounts, sort of like sprinkling it on the forehead. It's called baby tox, so small amounts, not as often, gives you a more natural appearance.
And we want to be babies.
I'm baby. Who is not a candidate for Botox? Pregnant women, breastfeeding, anybody with any sort of neurological disorder. I think this is something that you would have to bring to the attention of your doctor. If you have any medical problem, even if you think it's not relevant, I would still bring that up. Let your doctor know, and then they'll let you know if you're a candidate. But generally speaking, it's that group that I mentioned.
Botox can be customized, correct?
Botox should be custom. When you go to see an injector, they should customize the number of units specifically for your face. So what she's gonna have, you're not gonna have.
When you see someone that looks very done, like you look at them and you say they've had something done.
Yeah.
Why is that?
There's so many reasons. One of them could be that they actually want to look that way, and that's their choice. If they want to look super frozen, that's their decision. And it could also be, you know, how their body responded to it.
Oh.
I mean, don't be nervous. What I like to do is use a small amount, and then you reassess in 2 weeks, because the Botox takes 2 to 10 days to kick in.
Oh.
By the second week is when you see the final results, and then you always have the opportunity to go back and get more, versus throwing a bunch of Botox in your face.
And then it's too much in your
And then it's just too much. Yeah.
Oh, I like that.
Yeah.
What's the downtime after getting Botox?
You're not supposed to lie down for 3 hours, and I always tell people don't move your head around aggressively for 24 hours. It's thought that if you sort of move your head around or lie down, the Botox can move to different areas. So when you inject it in that one place, you want it to stay in the place that you injected it. There's always a risk of bruising with any injection in the face.
I bruise if you look at me wrong.
99.9% of the time, people do not bruise after a Botox injection.
What will you do different if you're doing Botox on somebody that really wants to keep their facial movement, but they don't want to have the wrinkles? Like, how do you do that? What is the difference between that and a standard Botox injection?
Several things. Botox generally lasts about 3 months, so maybe you would do it every 4 to 5 to 6 months rather than every 2 to 3 months. The other thing is less. Less is more. You still maintain your facial movements, and that's really important, especially as someone in the film industry, an actor, you want to maintain the expressions, so you just use less.
I feel like as actresses, we want the movement, we want we want the lines when we want the lines.
Yeah.
But when we're not moving, like on camera or just a still photo, we don't want the lines.
Yeah.
Like we want to tell the lines when to be there.
We want to read the lines. Tell the lines when they're going to be there during the
lines being read.
Yeah. You have the dynamic wrinkles that are the wrinkles that only appear when you make them appear, like when you move and you lift your brows or bring them together, smile really big. And then over time they become static, so they stop moving. And so a lot of times what people in the entertainment industry who need that movement, when they have the time off, that's when they'll inject themselves so that they don't develop the static wrinkles, so that when their movement comes back, they can look normal and like more natural on camera.
Oh,
does that make sense?
That's smart.
Oh.
Yeah.
Who knew?
I didn't. I'm learning so much. My brain is like that.
So it lasts for 3 months, you were saying?
Generally speaking, yes. So with anything in medicine, not everything applies to every person. So it might last 3 months for you, it might last 2 months for you, or it could last 6 months for you, and maybe 1 month.
Oh, wow.
It depends on your metabolism, your lifestyle choices, exposure to the sun, things like that. It varies person to person to person, but on an average in like the general population, it'll be 3 months.
All right, well, all we have to do now is try it.
Okay. I mean, since this is your first time and you're kind of nervous, I always like to start low. So I'm thinking only 4 injections for your first time.
Is that a little amount?
That's very little.
Okay.
Most people would probably suggest more, but the way I approach it is, like I said earlier, less is more.
Yeah.
So I would do this, and then in 2 weeks, you're like, hey, I think I want more. Then you can come back. Okay. Right? Easy, right? Okay. Tell me exactly, you want the glabellar and some of the forehead, right?
Yeah, I want to just soften the forehead lines, and then I basically don't want to be angry.
All right, so bring your brows together for me. Lift them up. There it is. And there's Jess. You ready?
Yes.
So I use this vibrating device that distracts you from the pain.
Oh my god. It didn't even hurt.
Yay! Breathe for me. Breathe. Breathe. So a little bit of bumps, but this literally goes away in 15
Does
minutes.
it?
Yeah, they go away.
You're done, sister. That was it.
Oh my god.
You good?
Mm-hmm.
The needle's so tiny. Yeah, it has to be.
It always makes me want to sneeze. I don't know what that is.
It's just like the area of the sinuses is probably feeling irritated. You good?
Mm-hmm. Try not to sneeze on you.
Right.
Is that it?
Yeah.
All right, friends, we are here to spill the tea on Botox.
For actors.
Yep.
I only said it 8,000 times that I was terrified. Game changer.
She's a believer.
I'm so happy. My face just looks amazing.
She did exactly what we talked about. We can still move our faces. We can still move our faces. We can still move our faces.
We can move.
But no lines right now. We're going to show you a little after video. We're going to put our movement video before and after so you can see the side by side, but honestly, it's amazing.
It's amazing. I've been getting so many compliments. People are like, you look so refreshed, like this and that, and people, they can't figure out why. And it's like, I have a secret.
Secret's out, bitches.
Secret's out.
I mean, I've done it before, so it's definitely a yes for me. Are you converted?
Yes.
So, yes for Botox for actors.
It's a yes.